Welcome. I'm Dr. Leon Popovitz, and today I have the honor of having my guest, Dr. John Munyak. Dr. Munyak is an internationally recognized non-operative sports medicine specialist. He's worked with very many athletes and dancers. He's consulted with the NBA, Major League Baseball, not to mention ballet dancers. John, it's a real honor to have you.
Honor to be here. Thank you.
Thank you. So it's an interesting perspective, being that you're a high regarded specialist in non-operative sports medicine, and I'm surgical sports medicine, so it's a nice compliment.
Definitely.
Yeah.
Yeah, it's great.
Yeah, and John works with us at New York Bone and Joint Specialist. He's one of our very prized and very valued doctors.
Oh, thank you.
So I wanted to really kind of touch on what's cutting edge, what's new, what's really coming out that's more and more options for patients, and it seems like regenerative medicine is really become the cutting edge as far as treatment goes, as far as options goes. So maybe we can just start with something simple and just explain to the audience what PRP and what regenerative medicine is.
Sure. So the body has its natural rate of healing, and sometimes that's just not enough to get someone to avoid a surgical procedure that maybe they're looking to not get because it's going to be more downtime that they can't afford basically on their sport, their occupation. Just getting from point A to point B is sometimes someone's sport. So in many ways. And maybe they don't have the insurance that's going to cover expensive surgery. So they say, well, what else can I do? So you got to know all the options. What heals the body is the scar process. If you break a bone, it heals with bone. Everything else scars back together, and the body just has to have that ability to get that scar process to be faster than the injury process. When you wear out your meniscus faster than the body can fix it. So you always lose that battle. So regenerative medicine can kind of even the score by injecting things that will help.
Very good.
Help enhance that healing process.
Interesting. So the process in of itself basically is that we're using healing tissue from our own body and injecting it into the patient's either knee or shoulder, wherever the healing is needed.
Yeah, exactly. So someone has cartilage wearing out, someone has a labrum tear in the shoulder or hip, someone has a torn hamstring. It can really enhance the rate of healing tremendously depending on what they need to be enhanced. Mm-hmm. So if someone's a high-level athlete, they say, well, I got a game on Saturday and it's Monday. We definitely got to use one of the big guns like PRP or stem cells, or maybe multiple PRP injections to get them ready to speed up the recovery. And it sounds strange. Well, how come the normal person takes up to 9 months for a hamstring to recover from? You read it all the time. Major League Baseball, this guy's out for the season from a hamstring in April. I'm confused by that also, because I'll inject someone's hamstring on a Monday and all of a sudden they're running their best time on Saturday as a Division I track star. So.
Isn't that great? Isn't that amazing? Yeah. It's extraordinary what's going on with regenerative medicine. So just dividing it up. So regenerative medicine includes, for the most part, PRP injections, plasma-rich injections, where it's basically drawn from the blood.
Yes, so it's their own blood. It's just, as everyone unfortunately heard now in the news with COVID, where people are getting plasma, to help get rid of COVID. It's the same plasma. So
your own plasma.
Your own plasma. This time instead of someone else's, and you put it in the machine, spin it down. It's about 20 minutes spin, and then inject it back where we want to heal.
Mm-hmm. And the cells that we are capturing for the healing, they are the growth hormone cells and the cytokines that are stimulating the healing process.
Exactly. So the growth factors are predominant in the platelets. So that's why when you spin it down, spin the blood down, you get just the platelet-rich plasma, the PRP abbreviation for, and that's what's going to really stimulate best. So there's all these kits out there that do that, and over the years we got kind of tired of the kits and the cost going over to the patient, and so we came up with our own way of doing it, and it's actually a stronger version because there's something called the buffy coat, which is the layer between the PRP on the top of the tube and the platelet poor plasma, which is your white cells and red cells, things that you don't need. And that little buffy coat is a layer that if you have a good steady hand, you can kind of suck that into the syringe. And we use 4 syringes. You're actually getting 4 buffy coats versus the 1 buffy coat you get if you use the standard kit. So I find our PRP is definitely even stronger.
So the more healing cells, the more plasma-rich cells you can capture, the more healing we can provide for the patient.
Yeah, exactly.
And other options as far as regenerative medicine goes, then next step is get even more cells would be the stem cell option.
Yeah,
Tell us about that.
So stem cells, people think, and it was even outlawed for a while by former President Biden, stem cells in general, because there was this misconception, you're going to clone a sheep, but it's not that kind of stem cells, though. It's the healing version. You're not transforming tissue into something. You're, again, just enhancing the healing of what's injured, and that enhanced healing ability to seal back together someone's labrum or someone's meniscus or hamstring, whatever you're trying to really enhance that maybe PRP didn't work or didn't work for the long term, is really just an enhanced healing. So you have your prolotherapy, you have your PRP, and then you have your stem cells. Just really, that's the level of attack basically on the healing that these things do.
Maybe you touch upon prolotherapy real quick.
Oh yeah. So prolotherapy is another really long-term, long history of use, and again, hopefully gives a long-term result. So it's the same concept of trying to induce a scar that the body couldn't make fast enough. So prolotherapy is commonly a sclerotic substance like dextrose or mannitol. And again, just the decades of experience, you see what was the best substance. So you'll only see mannitol in our cabinets because that's the best one overall. Just anecdotally and research-wise, it really works the best if something's going to work. So that one is, sometimes it takes multiple shots. I've had patients take up to 7 shots and find they're great with this. Usually you go 3, either weekly or every 3 weeks, depending on someone's schedule and what their desire are, how to get the injury healed fast. And I find by 3 of those shots, if it really hasn't done much, then we'll switch to PRP. Or maybe they'll give up and say, actually, maybe I'll just get the surgery. But
interesting. So getting back to the stem cells, so we got the prolotherapy is an option, but as far as regenerative, getting your own growth cells, we're going to potentially draw the blood for the PRP, and then the stem cell option is gaining even more cells, and it's your own cells. You're not getting cells from anyone else, although there are options like that too. But just speaking about using your own cells and the stem cells, where are those stem cells usually coming from?
Yeah, so you have the, as it's called, the BMAC or bone marrow aspirate concentration, and that's, you make a little hole in someone's pelvis, very benign procedure, even done in the office. It's anesthesia locally for that. Most people don't even feel a thing. And you get the bone marrow out, and then you put in a special spin also, and then you get your own stem cells from that. That's where the stem cells are forming in your bone marrow. And again, just same as the PRP. Then it's your own bone marrow, so no risk of anything.
So it's like a turbo boost. So one way of doing it is getting it from the blood, but then if you really want to concentrate and really want to get as many growth or healing cells as possible, you can get it from the pelvis.
Yeah, you get it from the pelvis.
The bone itself.
Yeah, absolutely. And even more aggressive, which actually this kind of follows with people who want not only stem cells but possibly even to shrink down their abdomen size a little bit. It's the lipogems system.
Yeah, tell us about that. That's very interesting.
Yeah, so this is where you actually do a liposuction. Again, in the office, a little nick. You get in, everything's anesthetized with lidocaine. So people feel nothing or maybe just a slight little burn just because of the lidocaine stinging a little bit. And you're literally doing liposuction, and then you put it in the same kind of machine. It concentrates down your own mesenchymal stem cells from your fat, and then that's injected wherever the healing is desired.
Extraordinary. So do you find that is there more, it seems to me like there would be more healing cells from the bone marrow than the fat. Is that the case, or?
Yeah, theoretically there should be, but again, we're looking at a scar reaction, so whatever's going to really irritate the most and stimulate the body to now have what you put in there, plus the body's going to react to it. Mm-hmm. So in other words, the body's going to see that in there and say, oh, what's this? It's going to send an extra amount of the cells to heal also. So it's this bonus reaction, basically, what you're getting. Mm-hmm. So it depends. It's hard to really know. Yeah.
Potentially, you can get the same amount of healing cells from the fat, from the belly, or from the pelvis. If you really want a turbo boost, take it to the next level beyond the PRP.
Yeah, I don't really know how you differentiate, because every person's individual how they respond to it. So if you say, well, I definitely have cartilage issue that I need to fix, then I would go more with the stem cells or the pelvis, BMAC. I would think the lipogems would be more of a soft tissue.
Lipogem is the fat.
Lipogems would be the fat from your abdomen, more of a soft tissue, or not labrum cartilage, but joint cartilage. I think may be more benefiting from that, like in a big weight-bearing joint like the knee. Mm-hmm. Or the hip. You do the lipogems. I think that might help someone with a bad arthritis there, to avoid a surgery as long as possible.
Interesting. And then the last option would potentially be to get stem cells from another outside of your body.
Yeah, so there's stem cell banks that are very regulated. Make sure there's disease-free. People may or may not know. When you have a baby, you sign all these papers to donate your placenta, stem cells, umbilical cord, and this is pretty much where they're getting them then. Mm-hmm. So, and it either comes in a dry ice, next day, male, liquid that you then inject right away, or it's freeze-dried powder you have to reconstitute and then inject it. Mm. So the availability is very restricted. There was even a moratorium on it again, until this past fall. You couldn't even get the liquid one until this past fall. Again, now the places that used to supply them went out of business because of that. So now there's new suppliers that are unfortunately more expensive because now there's demand. But again, I find that's great for hip or shoulder labrum injuries. Is when I find that's the best, that liquid stem cell mix.
So just to summarize, as far as regenerative medicine and options. So first of all, the indications. So if somebody has potentially arthritis, whether it's in the knee or hip or really anywhere in the body, tendinitis, inflammation of the tendons, or even a tendon tear, like an Achilles tendon tear or a partial rotator cuff tear.
Yeah, these chronic tears, as people call it, tendinosis.
Very interesting. And what are the other indications that you find?
So if someone has the joint cartilage that we were just talking about worn out, you could potentially give them enough time so someone says, you know what, I need something. I can barely walk. I'm limping. I have my son's wedding in a year. I don't have time to have a knee replacement. Can you do something to hold me over? So they may can do one of these just to make their knee or their hip or their shoulder, whatever the arthritis condition is, last at least till that.
Interesting. I find that it can be used really just about for almost any issue. I mean, we've been using it for rotator cuff repairs to supplement the healing, to increase it. We've been using it for people who don't want a rotator cuff repair, and if the tear is small and their function is reasonable, sometimes we can use it. So going back to the options, so the indications really wide variety: arthritis, tendon tears, cartilage tears, most or many joint issues. But the main ones are the arthritis, the tendonitis, partial tendon tears, or even some full tendon tears, and then the options. The most common one seems to be the PRP, where the blood is drawn from your own blood is drawn and then spinned, and then the real quality healing tissues are then injected. And then you have the option of using stem cells, whether it's from the pelvis, which is probably the more common ones. That's the one I've done, but I've never done the other option that you mentioned, is getting it from the fat from the abdomen, which is really interesting, very interesting. It's extraordinary how fast this technology is moving and the options are. And what we're doing is we're using our own tissues, we're using our own healing cells. It's really incredible.
Yes, it's great. And there's another spin also. So in the pain management world, you can actually do these injections to help with people's spinal issues too. Again, same thing. Worn out cartilage between the bones in the spine, because essentially that's joint cartilage as well. So everyone thinks, oh, my joints are my knees and my shoulder and my hips. They forget the spine. They're a whole stack of joints. Mm-hmm. So this could help there to glide the joints, maybe regenerate some muscle tears that have been developing over years with bad posture and things like that. So the pain management world has this also.
That's really extraordinary. So how about things like stenosis, like degenerative stenosis, arthritic constriction of the nerves in the spine? Has that been used for that?
I mean, people are trying it because surgery, as you know, is very, aggressive and possibly not, the greatest outcome or no outcome. To do these cage procedures and things for stenosis. So people are trying it, and essentially, it's if you get better movement. I think that's really how it helps, because now you have better joint fluid, joint cartilage between the bones, and now you're moving easier. I think now the nerves essentially have more breathing room. I don't know if it's really regenerating nerves, but it's regenerating action in the spine that's more comfortable, so now you don't have this locked up spine.
That's a great point. It's the movement, and that applies to all joints. It's the movement. If you get that flexibility back, all of a sudden the pain seems to lessen. All of a sudden the function improves. People are happier when they're able to move. I mean, that's really the focus of life, is movement. Right? We all have to move. Yeah, that's extraordinary. Yeah. So I'd love to hear a case. If you have an interesting case that you used it for.
Oh yeah, I mean,
I'm sure you lied. Yeah, I'd love to hear more about that.
Yeah, so and I have great follow-up on a specific case I'm thinking about. So I have a lot of active people and high-level athletes, and one in particular was just told them they had a large labrum cartilage tear in the shoulder, and they was like, I'm not getting surgery. Figure it out.
So he had, it was a he, I presume?
Yeah.
It was a labral tear, which is a cushion of cartilage in the joint, in the ball and socket joint. That's important for stability.
Yes.
And the labrum was torn. It was a young athletic person.
Yep.
And they did not want surgery.
No, yeah, high-level athlete. Didn't want anything going for a big deal. And so I said, well, PRP, it might help, but it would be best if we just went right to stem cells, that liquid version we were just talking about before. And because I just found that I don't know if there's studies that support it, but anecdotally, I just find that definitely seals the deal.
Which stem cell was it again?
The one that comes dry ice overnight, already still liquid from the actual placenta.
So it was not his own stem cells, it was from the bank.
From the bank.
Interesting.
Yeah, I found that would be just really the best way. Just, again, it's, medicine's a lot of evidence-based research, and somehow the studies just don't show PRP and stem cells what they really do. I think if you live it and you see how people return to function, you realize, I don't know why the study just showed kind of equivocal results. It's obvious, and you get an MRI and everything's healed, that something good happened. So that's the case with this patient. That's why I like this one specifically, because they were a long-time patient and got to see them for other things. and then all of a sudden had another shoulder injury years after that stem cell, which normally you don't get a labrum of that size of a tear fixed surgically. It doesn't go away. You'll do an MRI 20 years later, you still see it. So in his case, the MRI was redone for a new shoulder injury and normal labrum. It was a new injury of the shoulder, so it showed that it actually did heal it. And that was just maybe 2 or 3 years after that injection.
That's extraordinary. I've never seen that. Like since we're talking about labral tears, it's a good topic to touch on as well. But I've never seen it like where the labrum is healed.
It's healed.
Once there's a full tear, unless it's surgically repaired. I've never seen that it be fully healed.
Yeah, this was fully healed. MRI, normal labrum.
Wow. That's a case study. Yeah. So just to touch on labral tears, so there's a labrum in the shoulder and there's a labrum in the hip. That's probably the more common ones people talk about. And so the labrum in the shoulder surrounds the socket portion of the shoulder, ball and socket joint, and it helps with stability and a lot of important ligaments attached to it. And a lot of athletes tear their labrum. It's really more of a condition of younger people than older people. Older people will have degeneration of the labrum, but speaking as a surgeon, we usually don't operate on the older degenerative labrum. It's more often the young, athletic, highly functioning people who really want to function, particularly have difficulty with overhead activities. And we often try some conservative treatment first, and that's where PRP can really come in. It's interesting, because you're speaking as a surgeon, we almost always, unless there's like a big displaced piece that's interfering with the motion, or the patient's very unstable and keeps dislocating, typically we try conservative treatment. We try the physical therapy, we try the stabilization procedures, and here you're saying that we can add to that conservative treatment PRP or stem cells. Yes, regenerative medicine. And that really kind of opens the door to allow a lot of patients to potentially avoid surgery. And of course you always want to, if you can get somebody better without surgery, of course you always want to do that. So it's really extraordinary that you've come across that, and I think that a lot of people would need to consider that more and more. That's great. That's great. And have you used it for the hip at all?
The hip, most people just kind of they think about it and they go for the hip replacement because that's just an easier option. I think overall, you get the hip replacement surgery, you're walking that day. The shoulder is a little easier to deal with because you're not walking on your hands. So you can get away with laying low for the 6 weeks after the injection of stem cells. Now your shoulder is good. The hip, most people don't want to use crutches and do what you really need to do to make the stem cells, optimally work, which is pretty much non-weight bearing or minimal action for 4 to 6 weeks with the hip. So I found it's not as popular of a choice. Patients just don't want to do that. Yeah, they just don't want to do it.
And it's interesting because the hip labrum somewhat has a parallel where a lot of people, younger people, have a labral tear. Just like in the shoulder, we'll try conservative treatment first, and then if that doesn't get better, then they proceed with labral repairs for the hip, and that's commonly done. But again, it may be an option, the stem cells, as far as trying that adding it to your tools in conservative treatment options. It's interesting. We use PRP very frequently for people who want to kind of increase their chances of healing after surgery. We use it for rotator cuff repairs. We've used it for labral repairs, even for meniscus repairs. Have you used it for the meniscus?
Oh yeah.
Yeah.
So meniscus, same concept. It's huge weight bearing joint is the knee, and so someone really has to not do anything strenuous for that 3 to 6 weeks afterwards. So if they do that, it works. If they don't, one false move and you've basically split open the tear that you're trying to fix. So people have to really be reliable to get that shot, they can't just think, oh, it's a magic bullet. I got the shot, now I'm good the next day. They have to know, all right, I have to let the healing actually take place still.
Yeah.
So if they do, then yeah, it's a great option. PRP and a knee brace, and not doing anything strenuous, not big force on your with your foot jumping or walking hard or doing any exercise for that 3 to 6 weeks. It should do something.
That's great. That's great.
Definitely keeps people going, and it's again how bad the tear is also, though, as you mentioned before.
That's a great point.
Some of these tears are so big that you really should just get a surgery.
Right. I would agree with that. Just since we're talking about meniscus tears, it's a good thing to touch upon. So the meniscus is a cushion of cartilage between the two major bones in the knee, and it protects the lining of the bones, which is covered with like an eggshell layer of cartilage called articular cartilage. And that meniscus gives that cushion. It also gives a certain level of stability. And you can tear the meniscus usually two different ways. Trauma, which is usually the younger patients, athletic patients, but of course as you get older you can certainly tear your meniscus from trauma as well. And then there's some people who tear their meniscus with no trauma at all. All of a sudden they feel a sudden pop in their knee or a gradual progression of pain in the knee. That's called a degenerative meniscus tear. And as far as just, again, speaking on the surgery end, it's an interesting way to complement each other. Typically for us, if we see a traumatic tear, particularly if the patient is unable to straighten the knee, that's absolutely an indication for surgery, because that piece is displaced and interfering with the mobility, or even if the piece is displaced but not interfering with the motion, more often than not, those patients would need an operation to fix that piece, because the PRP or the stem cell, whatever you do, it's not going to interfere. The other thing is that when people tear their meniscus, if it's not repaired, especially at a young age, it may cause the arthritis to progress very quickly. So we want to preserve that meniscus. It's very important to preserve our cartilage in all our joints. So here we're talking about using now the regenerative medicine options, whether it's PRP or stem cells or banked stem cells from your own body or banked stem cells, to potentially heal this cartilage without surgery, if it's a tear that's not very displaced and not very big, that's not going to progress to arthritis. I've seen it used for small tears, and people love it. People love it. Yeah.
Even going back to the meniscus and all the options we discussed earlier, I've seen people with just the prolotherapy mannitol injection heal a meniscus tear.
Yeah, that's extraordinary.
You'll see a follow-up MRI and it's just not there anymore.
That's really extraordinary. That's really extraordinary. It's amazing how regenerative medicine is really kind of pushing medicine to the point where it's going back to our own bodies. It's going back to our own bodies to allow it to heal, instead of relying on all this extra unnecessary, potentially invasive procedures, where you can go back to use your own body to heal. And that kind of expands to what's going on now in the holistic world in medicine, where a lot of people are choosing to find ways to improve their immune system to heal their bodies instead of choosing other medications.
Yeah, very good. Yeah, definitely.
That's great. Thank you so much, John, for joining us. This has just been such a great conversation, and I hope that you can join us again very soon.
Very good. Thank you so much.
Thank you.
Have a nice day. Thank you.
Thank you very much.